Welcome to Corona Stories from Observing the Process. I'm your host, Alex Greenberg. And before we start, I'm hoping you can help me out by supporting the show. You can rate and review it on iTunes, Stitcher, or wherever you listen. You can share it with your friends, you can blog about it, or discuss it on your own podcast. If you're watching on YouTube, you can subscribe to my channel and like this video. Or you can support it directly. You can do this by going to the shop on my website. I'll leave a link in the description. Thank you for supporting the show. Listeners like you make it possible. If you are looking for information on how to protect yourself and stay safe from COVID-19, please get information from the CDC or the World Health Organization. Today on the show, I had Susan Allott. Susan is the Director of Preventive Services in Essex County of New York. Please welcome Susan Allott.
In the land of China, people hardly got nothing at all.
No possessions?
And in China, they never go to church.
No religion too?
Or do magic.
Well, it's easy if you try, Dick.
Hello.
Hey, Susan, how are you?
I'm good. How are you, Alex?
I'm doing great. Thank you for taking the time to call. I really appreciate it.
You're very welcome.
Great. So before we get into it, I was thinking maybe you could just give a brief intro to who you are, where you're based, what you do for work, that kind of stuff.
Okay. So my name is Susan Allott, and I'm 62 years old. I was born and raised in Essex County and Westport, New York on Lake Champlain. I'm number 10 of a family of 14. My dad's a veterinarian, and he carried the torch into Lake Placid for the 1980 Winter Olympics.
Wow.
So unfortunately, I was in California in 1980. I became a nurse, an RN in 1977, and had the travel bug. So I held a nursing license in 5 states, New York, California, Delaware, Maryland, and Vermont at one time. Decided to come back to Essex County when I had my first 2 boys because I wanted them to be raised where I believe is just a beautiful place to raise children and to get to know their grandparents. So we moved back up to Elizabethtown in, probably 1995. And my daughter was born here in the Adirondacks. And that is when I got into public health. I mostly worked in the hospitals. So about 17 years ago, I started working at Essex County Health Department, where I'm currently the Director of Preventive Services.
Awesome. That's a great intro. I was sharing your notes with my father, who's actually a doctor, and he was curious kind of about your route of how you got into specifically where you are. He was mentioning there might be somewhat of an interesting story, like how you got to where you are. Your title is Director of Preventive Services, and he was thinking that's not, people don't necessarily end up there. So I was curious maybe if you could talk a little bit about that, how you ended up in that specific field.
So that's a great question. And I imagine that it's a title that is not very common. When I started at the health department, I was looking for a part-time job. And I started as the HIV tester and educator. So at the time, there was a misnomer that HIV was fairly high rates in Essex County because we have several prisons. And so people before me had written a grant and secured funding for a position where we really don't have very high rates up here. So I worked as an HIV educator and test counselor for probably 3 or 4 years. And when the grant came up to be renewed, it was not renewed. So I took a position. They offered me a position as a registered nurse at the health department. And so I continued the HIV work I was doing. And it was mostly education in schools. We didn't do a lot of HIV testing. And then I found an opening in the children's services area. So I worked early intervention, preschool, and children's special health care needs, and then kind of got into more family health work. And there was a change at work where working part-time, I was no longer going to be offered the health insurance benefits I had. So I was given about 2 months to make a decision to take a full-time position. And this current position I have was a supervising public health nurse position. But the county soon realized that it was more than that. It was administration, because it was oversight over anywhere from 6 to 10 grants at one time. So they made the position from a supervising public health nurse to a director of preventive services position.
Wow. Yeah. Great story. So kind of talking more about preventative services, and how the topic of conversation, I guess, is the coronavirus. So when did you first hear about the coronavirus?
I heard about the coronavirus in January of this year.
And what were your first impressions? Did you think it was going to be a very I don't know anyone that really thought it was going to go this far, but maybe your first impressions.
Well, I being a public health nurse, and I'm not sure if you're familiar with the term of population health, but nursing up until this last 5 years for me was individual health. So now more thinking about population health and initiatives for the health of a population. And so when I first heard of the coronavirus, my thought was, it's flu season, and people are influenza and pneumococcal vaccination rates are not at all where they should be. And so it's a great opportunity to promote vaccination while kind of utilizing the coronavirus front for that, because coronavirus is more interesting to people than influenza. So we did do a lot of public awareness around, yes, coronavirus is out there, but get your influenza and pneumococcal shots, pneumonia shots, because that will help protect you if you get this virus, if you get sick.
That's pretty interesting to almost use it as it's hot in the news. So you're kind of taking advantage of a situation to get people's attention, if I'm understanding correctly.
Right. Sort of like a tagline.
Yeah.
And at the time we were like, well, it's not here, but that was an opportunity.
Okay. And something else I was a little curious about is, so you're the director of preventative services for Essex County. So this covers the county of Essex. How big is that? What's the population roughly for that?
39,000 people.
Okay.
Roughly.
And I know you mentioned this in your notes, but roughly how many people are in your unit, people that you work with on a daily basis? I'm just I want to gauge kind of, how many people are responsible for that 39,000.
So we have 6 core people in our public health department. We've had a little bit of turnover recently. I have 2 clerk positions that are open. So 6 core people and a director above me. Those core people include myself as a registered nurse and a family health registered nurse. And we have a public health educator, an emergency preparedness coordinator, a chronic disease coordinator. And let me see, we have another registered nurse who's on maternity leave. So I guess if we were full staffed, we would be 7.
Okay. And is this average for every county in America, or would it kind of differ state by state?
It does differ state by state. Vermont has a state health department, where New York is divided up into county health departments.
Okay.
So, yeah, and there's some 20-odd counties in New York, and the larger counties have larger staff, and they would have one staff person who would be responsible for immunizations and another responsible for preparedness. But with our small staff, we all need to cross-train to all programs.
Okay. And let's take the perspective of before this happened. Let's say we're in December. I'm curious if you were then in December, November, before you ever heard of this, would you have said that organizations such as your own are ready for a situation like this?
Well, we, with our preparedness grant, emergency preparedness grant, in order to meet the deliverables, we do so many activities and drills per year. And it's interesting because the drills for 2019 and then the one we just did in March of 2020 were around merits, the merit system, which has to do with accessing mass distribution of supplies we might need. So it's basically a state system and it's electronic. So we electronically access it and say, okay, Essex County needs so many masks, so many, whatever it might be, supplies we need in an emergency. So we do drill this and we were ready for this particular situation, but we did not expect there was going to be such a shortage of supplies as we put in our request.
Okay. So let's jump into you're starting to do testing on people. So what was your experience like when you first had to start testing people? And if I'm mistaken, were you testing people? Kind of talk about that experience.
Yeah, so we put an order in right away for 100 tests and also put an order in for thermometers because part of symptom checking is people checking, their temperatures. And immediately heard back that the tests were back ordered. This was in early February. And the thermometers were back ordered. So I sent my clerk over to Kinney Drugs and said, buy as many forehead thermometers as you can. And they had gotten a truckload in the day before and they were completely gone. So that's, kind of when I realized that we were in for a long haul, and the state was really good. They said, a symptom check is fine. Subjective fever is okay. We don't need to know exactly what somebody's temperature is. So, we kind of, and I still have people out there who don't have thermometers. Although the good news is Thursday, we tracked the thermometers and they should be here next week. Although I don't think we'll have test kits for some time. So we never at the health department, I wrote a protocol right away and got it approved by our medical director so that if we do have the test kits, we can, our nurses can work together and we have the staff to make that happen. But I don't expect that's going to happen in the next few months because the entire state is in shortage. I don't think they would provide them for a small health department.
Yeah, so let's talk about the testing kits for a second. To my understanding, it's not the easiest test to do. I've been to an ENT before, and they've stuck like a long, not a stick, but it goes pretty far up your nose. Is that similar to what this testing, the actual test is?
Yeah, so in the beginning, they were saying it had to be an NP or nasopharyngeal and an OP or oropharyngeal swab. So you would get two swabs, one would go way far up the nose and the other way back in the throat, and put them in the same media. And then that would be shipped off. Initially, Wadsworth Lab in Albany was the only lab we had access to for testing. And then several reference labs became available. So we're in really close contact with our healthcare providers. And so the providers would make a determination as to whether someone needed testing, and then they would call us for guidance, regarding symptoms. And so initially the providers needed to get permission from us to use the state lab from the local health department. And then when the reference labs popped up, they started, being more independent with taking specimens and sending them to the reference labs. The reference labs take 5 to 7 days to get results back, where the state lab is 2-day turnaround.
So the state was actually quicker than the reference lab.
Yeah, the state was sending sheriffs and state police to courier the specimens down to Albany, and that the lab in Albany was running 24/7. They can run so many specimens at a time, and it's a 6-hour turnaround from what I understand.
Hmm.
And so they would run 24/7, fill up the machine, and just, mass produce results.
Yeah, because I guess from my perspective, as someone who knows virtually nothing about the healthcare system and testing, it seems like it's the most important thing. If we were able to just get everyone tested as quickly as possible, that would alleviate a lot of the problems. For example, if it was possible to do a test at home, is that something that is possible in the future after this, or could that have been possible? I'm just curious about exploring that.
Well, hindsight is 2020, and had
Hmm.
we known this was going to be, an issue, certainly, I think that the production of test kits could have been increased.
Hmm.
I expect that there is a test out there. It's not available now, but probably has gone through approval, FDA approval, to be made available. That could be a home test kit.
Hmm.
I mean, we've done it for so many other things. You can get a home test kit for HIV and swab
Right.
yourself and have your results in 20 minutes. So why not for this? So I just don't know how available it's going to be, and I
Hmm.
imagine it will be triage to areas such as New York City that are hotspots at this point in time.
And when you say triage, you mean just like priority to those areas?
Yes,
Okay.
yes, yeah,
Okay.
yeah.
And I guess just a more broad question is kind of like why we were so unprepared, it seems like, or maybe we weren't so unprepared. It's really hard to say from just my perspective from the media, but I guess in your opinion, were we very unprepared? Because it seems like there was a solid 2-month period of us knowing that this was possible before the country took strong actions. Like, for example, it felt like it got very real when Trump instated the Europe travel ban. I'm just curious your thoughts on the timeline.
Mhm. I don't think we took it seriously.
Hmm.
I think that, when that cruise ship, when people were finally brought off that cruise ship, that, there was definitely some mistakes that were made. And the travel ban could have happened earlier. Again, it's hard to know, what could have prevented it, or could it have been
Hmm.
prevented. But we just live in a world where, mass transit and travel is such a normal part of our lives. And as human beings, I think that, human nature is to not react to something until, it's like right in your backyard.
Hmm.
And but I do think that the current administration, made some pretty serious mistakes.
Sure. Yeah, as you said, hindsight is 2020, and I think that's very important to understand. Um, Another aspect of your job, you mentioned talking to the worried well a lot. And to my what I am thinking, that just means like concerned citizens calling in. I was wondering if you could talk a little bit to your experience about that. Talking to people from, I guess, upstate New York, and you must have been getting all types of questions, and that experience, I'm just pretty curious about.
Yeah, I mean, there are all kinds of reaction to this.
Hmm.
And I just, having been a nurse for so long, I don't mind talking with people, and I believe I have a very calming manner,
Hmm.
and I'm a good listener. So I think I mentioned also that I'm on call quite a bit. So some of these work calls were coming in after I'd work a 12-hour shift and finally sat down at home, and the beeper would go off, and I'd call, and there'd be a message from someone who was just beside themselves, worried about, they had a runny nose, and they were sure they had it, and they were afraid they were going to die. And this one particular woman I talked with, and I said, well, get lots of fluids, and take some Tylenol. And her response was, I'm an addict, I can't take drugs.
Hmm.
And I said, okay. And tried to again talk her down and say, well, if your throat is sore, what about some honey and some tea and that type of thing? And So she finally, I mean, she was hysterical. And by the end of our conversation, she had settled down a bit. And, she really wanted to be tested, but we don't have testing available, or it's being, as I said earlier, triaged for, people who potentially are healthcare workers. Maybe I didn't say this, but people who are healthcare workers or work at residential facilities and first responders. Those are people that with a limited number of tests that we're really putting them aside for. So I basically said to her, you're not going to be able to access testing. If you're really sick, call your healthcare provider. And she ended up in the emergency room that night. So I don't know that I did my best job with her. I guess she was going to head there anyway, regardless of what I said. But her mental health care worker called me the next day and said, did you talk with this person? And I said, yes, I did. And so we were able to talk through, some of the things that led her to going to the emergency room. And, I just want to say that the providers out there are amazing. They really are. They're inspired to help people, and they're challenged by this new curveball we've been thrown, but they're really committed to their patients.
Wow. Well, first of all, I want to say thank you for taking the time to really do your best to talk to that person. That's a very valuable, thing we need in communities. And it leads pretty perfectly into a topic of conversation I have with all of my guests, which is your thoughts on the media and how they're handling the situation, and also how it affects our mental health. Because I truly feel overwhelmed watching almost any news today, and to me, it seems like it's more of media when it should be news. So I was curious on your thoughts on how the news/media, is handling the situation.
Well, I think they could take a break from being so reactive. And it would be really, I think that awareness is really huge. And the media certainly has a really pivotal part to play in getting the message across to people to self-isolate, to decrease their movement, to stay home, and to really think really critically about, before they have interactions with other people. So I think that's really helpful. But the scare tactics, and I learned this very, when I was working with the HIV and STDs and with young people, you can't scare people into using a condom. You can't, scare people into activities that will decrease their risk of diseases. So I think what we see out there is a lot of scare tactic. When there are more evidence-based measures, researched measures that have been proven to lead to more healthy behaviors. So I understand what you're saying, Alex, and I also thought that the media, I just couldn't listen. I lived it every day, and I'm living it every day. So to come home and listen to it on TV, and it was just like, wow, couldn't they tell a success story about someone who potentially didn't get infected because they took proper precautions? But so yeah. We do have a public information officer at work, and we really look critically at everything we put out there, and we are not alarmists. In fact, early on in Essex County, our social center for teens in E-Town, they consulted with us. Should we shut down? Should we shut down? And I said, you probably don't want to be having activities for the public right now. And they were concerned because someone had been and worked in the social center and who was sick, who hadn't been tested for COVID-19, but could have had it. And I said, well, that's even more reason to shut down. So she said, okay, I'm just going to put something low key out on social media. And no more than 15 minutes later, I got this call from my director because she had put on social media that they had reason to believe that that there was a COVID positive person who had worked in the social center. And so it just blew up, and it got something like 1,000 hits in over 20 minutes. And the Board of Supervisors was like calling us, telling us to shut it down. So I got in my car and drove down there because she wasn't answering her phone or answering emails because she was bombarded, and said, Erin, you need to take that down right now. You can't do that. She didn't mean to do it. She felt really bad, but that's sensationalizing.
Sure.
And it had a lot of people, people were calling in saying, I took a yoga class there. Should I go get tested? It just blew up.
Wow.
And that's the kind of thing that we do not need in this situation. We really need for people to calm down and think sensibly about how they can protect themselves and their families.
Sure. Something interesting you mentioned in your notes was somewhat of internal struggles. And, I don't know if I misread this, but there was somewhat of an internal restructuring to just handle the capacity of calls and all that stuff. So I was just curious of your thoughts, not to like talk down on who you work with, or just like more of just like constructive, like coming out of this, looking at it in a positive light, how we can learn from this situation. If you could speak a little bit about that.
I don't know if you're aware of the Myers-Briggs temperament instrument, but it's something that I've always thought that I wanted to do with my staff because, there are some very strong personalities, and I tend to be more of a nurturing personality. And as a director, I think that that's very effective. And I think that the people I work with are really talented. They have great experience. But in any stressful situation, I think that personalities definitely do become stronger.
And not to cut you off, but if you could explain the Myers-Briggs, I believe I'm a little familiar with it. It's kind of like matching personality types with other ones because they could work better together. Is that correct?
Right. And if you understand how other people work, then you kind of respect that space. And so the change in the structure, myself being a director, my immediate director is the incident commander. So anybody who's familiar with emergency preparedness knows the incident command system. So the incident commander is the person who, pretty much runs the show, and then there are strategic positions under them. So there's a planning section chief, and let me see, I have to look at my notes here.
Sure, take your time.
Actually, I think I might have put it in what I wrote to you. So there are a couple of section chiefs under that. And I'm the operations section chief. So I went from having, direct responsibility over my staff to my director having direct responsibilities over my staff. And I get that. And it's something that we have practiced before, but I really, I think some of the struggles internally, they were very short-lived. And it more had to do with getting a system down to have more of a strategic approach to this specific situation. In other words, we were only 2 nurses, and a lot of my staff, the outreach coordinator and the preparedness coordinator, weren't really comfortable walking people through a symptom check. So we recruited some nurses from our home care unit. We are a health department that's still one of the few in the state that has a home health unit. So we recruited some nurses to help us with the symptom checks and with the isolation and quarantine and with the intake. And I think that was really helpful. And because I was so swamped with taking calls, I really felt that I could not, I couldn't fulfill my duties, I guess is the best way to say that, in the preparedness realm. So, because I was so swamped with calls from other people, which I really enjoyed, and it really needed to be a registered nurse to do that, my operations and section chief duties were kind of taken over by other people, which is what needs to happen. And in a well-oiled machine and a group of people who have worked together so well for so many years, we pinch hit for each other. And I think I mentioned earlier, we're all cross-trained. So, but that change in roles definitely caused some stress, some internal stress.
Yeah, that sounds like it's going to happen in any
Mm-hmm.
organization, whether it's in
Mm-hmm.
healthcare or, the automobile
Sure.
industry. It doesn't matter. People are people. And it sounds like that's just the nature of what could happen when something like this occurs.
Mm-hmm.
You might not be able to speak much to this, but the infrastructure of the healthcare system as it is, for example, I mentioned at the beginning, I think my dad is a gastroenterologist, and he does mostly elective procedures, and they canceled all of that. So currently, he's not doing much of anything. He goes to his office rather than is in the hospital, and whether he wants to be a part of coronavirus relief, he's not really able to. So I was wondering if you are able to speak on that, if there could be some type of change, and maybe within the coming days or weeks it could change that he's reassigned to help out in a way. But maybe you could help explain to listeners, my dad specializes in something. It doesn't necessarily mean he can help out with this, or I'm just curious your thoughts on that type of situation.
Yeah, I don't know how many years your dad has specialized in gastroenterology, and how long ago potentially he was comfortable working in primary care.
Mm,
But I know that I received last week a survey from Governor Cuomo, and I believe it went to all healthcare providers in the state, asking what our expertise was, what our availability was, and would we be willing to, work in other areas. And the outcome of that was, I believe there were over 5,000 people that they were able to recruit from the healthcare field
mm,
to relocate and or to work in other areas to help to mitigate the shortages around the state.
mm,
And for myself, I mean, I've been out of primary care for 17 years. I've not done hospital nursing for over 17 years.
mm,
So I'm not at all ready to jump into an emergency room situation, or even I could probably do a doctor's office. So I basically replied that I'm willing to help in any public health area, and if there's a vaccination, eventually to, help stand up clinics and do population health type of activities. So I don't
mm.
know if your dad received that survey or was able to respond, um, that he could potentially help in specific areas.
Okay. Yeah. So if I'm understanding correctly, like just because my dad is a GI, in general, what people are looking for is primary healthcare providers. Those types of people are best suited to take care of COVID-19 patients. Is that correct?
Yeah, I think so.
Okay.
Sure, sure. Hmm.
Okay. Another thing, I don't know if you've ever. There's a YouTube video by Bill Gates, and it's a TED talk, and it's the next outbreak. We're not ready, and this
Hmm.
video was actually filmed 4 years ago, and it's kind of blown up because of obviously what's happened, and basically the bottom line of his TED talk is that we're not ready for the next epidemic. How do you think we're going to move forward? Um, After this is kind of settled, you know, do you think the infrastructure of the whole healthcare system, I'm imagining, must, I foresee like a dramatic change in how everything's going to operate. I'm curious on your thoughts.
I sure hope there's a dramatic change. I've been thinking that we're not well serving our young people. Our young people are ingrained for, and this is not a bad thing, but with cell phones and technology, with getting more instant answers, and with doing business more remotely and through social media. So I really hope that telemedicine becomes more widely used and more
Mm,
widely available. I talked to a very rural healthcare provider here in Essex County, through some changes that would bring to his clinic telemedicine, and it was a challenge for him. Certainly a challenge. He's the only provider within 40 miles of any other provider. He traveled back from the Dominican Republic and was put on quarantine.
mm,
And his thought was, I need to see my patients. And so he fell under a New York State guidance for return to work for essential employees. In other words, if a healthcare facility or residential facility cannot continue because they don't have that provider, because they're furloughed, New York State said, well, they can do their quarantine between work and home. So he did that after providing telemedicine, and then called me back and said, I'm struggling with the fact that I'm bringing these people in to see me, and they're sick and they're supposed to be home isolating, and now what have I done? So I think it's just that thought process of, we're all used to driving to work every day, and would it not be better on the economy? I mean, certainly I don't want to lose sight of face-to-face visits, but there are a lot of instances where healthcare can be provided remotely. I mean, we've had to go to telemental health up here because of our limited mental health providers. And I'd really love to see the healthcare system explore that more widely. And I think young people, to make an appointment, actually go into an office, or potentially you can have a face-to-face with someone on the screen who, prescribes birth control, or, takes the symptom check and gives you a prescription for antibiotics that you can then have delivered to your front door. It just seems so much more efficient to me. And I think it would bring healthcare costs down as well.
Absolutely. That was something you mentioned in your notes, was simply the word telemedicine sparked me to write it down in my notes and create a question. Just, could you speak more to it? And you just did. So what I'm understanding, telemedicine sounds like just a broad term of, communicating by the web or by telephone and being able to figure out what's going on without having to go to the doctor's office.
Exactly. And we found actually with our older population, older folks who are home alone, that telehealth has also helped for them to become more socially connected and less lonely and less isolated. The units we have at the health department, we received these through a grant, a federal to a state grant. So basically they can take a weight, a blood pressure, a heart rate, a respiratory rate from home, and they can alert us at the office if there are any of those parameters that are out of the ordinary. And so we have one nurse dedicated to all the telehealth lines. We have over 40 placed in homes throughout Essex County. And this is a rural area. So I think it's so important that these people in their homes are connected to a provider at least once a day, sometimes twice a day. So, I think it's really got great application. And we've used them for TB patients, tuberculosis patients, because if someone has tuberculosis, as a health department, we need to check in once a day and watch them take their meds. It's called direct observed therapy. So we use telehealth for that, and we get on with them remotely and watch them take their meds at home. Through the course, it could be 6 months that every day we get on and watch them take their meds.
Wow. Yeah, it sounds like kind of an obvious choice. I mean, are there any downsides? To me, it sounds like, not playing devil's advocate, but just like the downsides could potentially be you're relying on your patient to provide correct numbers, and like you said weight and doing that stuff at home. Is that like one of the concerns, or?
Well, no, the machine does it all for you. We put the machine in the home.
Oh, you got machines that go into the home. Okay.
Exactly.
I didn't catch that. Wow.
Yeah, so no, I probably didn't say that. So actually the scale, the blood pressure cuff, all that's in the home. So they just connect, and then their parameters are automatically relayed to us in the office.
This sounds like an amazing opportunity. Like, I'm always curious in like looking at this now from the business perspective, there could be a tremendous amount of units sold to everyone in this country to do your healthcare at home. Is that right?
Sure. Yeah. So, there are people obviously that are critical, like a diabetic type of thing. Certainly the telehealth machine at this point in time can't monitor a blood sugar, but that doesn't mean that technology can't happen, that it could monitor a blood sugar. And I think it's got really great potential. Yeah, absolutely.
I don't know if you're familiar. I mean, you might have heard the Apple Watch, but Apple is starting to dive pretty deep into healthcare. I don't know exactly what it does. I believe like maybe your blood pressure or your heart rate, your Apple Watch can tell you that. Like even if you fall, your Apple Watch will, have a detection. Like, oh, you've fallen, call 911 immediately. There's patents for their headphones to be able to give you certain vitals, like Apple is going to sleep. It's a very interesting topic to look at how technology, like wearables and that kind of stuff.
Right, right. And then also other businesses like Amazon and pharmacies are all dipping into healthcare. And I think that hospitals and physicians, and I know that many are, certainly we are aware up here. Our local hospital in Elizabethtown is part of the University of Vermont Healthcare Network. And so we are really very aware that we need to stay on the cutting edge of healthcare because businesses are really wanting to put pop-up clinics up and to dip into healthcare and the money that can potentially be made. So, and that's kind of scary. It really is kind of scary.
Yeah, I could understand. It's I guess the idea of, public versus private. You have these big tech companies who are private and, their motives are money. It's flat out. Their businesses,
Sure.
right? So that's where it gets scary, I guess. And then,
right.
Yeah, it's very interesting topic. I guess that's another one for a different day.
There you go.
one thing you mentioned in your notes was this thing called contact tracing, and that's a part of the testing for it. Could you explain a little bit more about what contact tracing is?
So people who should be, by our guidance on isolation and quarantine through the health department for COVID-19, are people who we know have been in contact with someone with a confirmed COVID-19 diagnosis. And so if we have someone who's got a confirmed test, we call that person up and we talk with them about where they've been for the last 24 hours and where they've been since they received their positive COVID-19 test. So the first one we received in our county was a person who had traveled down to the Buffalo area and for a sports event and had contact with many, many people prior to coming back to Essex County. So we assumed that she must have been exposed there. And so we went, people were really very, very helpful as far as much as they can, providing their histories. So she was able to trace her steps and talk to us about where she'd been in the community. So this included a grocery store and a drugstore and a library and a residential facility. So then we would go to the grocery store and say, okay, this person was in your store this day during these times. Can you show us your register so we can alert the people who are potentially in the store at those dates and times also because this person had COVID-19. Usually businesses do provide us with what we're asking for. In this particular instance, the business did not want to provide their register. So we put a public notice out. And that public notice basically said, if you were in this particular grocery store on this day during these times, you should, be aware that you might have been exposed. So, that's part of our contact tracing. And then whomever the person potentially was exposed to, if they don't have their information, then we try and find them and let them know.
Wow. It's an extremely detailed and extensive process. What I was going into that question, my kind of theory was going to be, people aren't reliable, but it sounds quite the opposite, that people were extremely helpful for this. But it just kind of brings the first thing when I heard about that was that for example, in a court of law, when you like a murder trial, you have an eyewitness, they're actually extremely unreliable from what I've heard. Eyewitnesses in general are unreliable. And I kind of correlated that when you're looking at contact tracing, you're looking at getting information from these people. But I guess I'm happily surprised that is very useful in this medical case.
Yes, yeah, I thought it really was. I was a little disappointed with, the grocery store who was not willing to, provide the information that we were looking for. But, I thought that, from the 5 cases we've had, people have been very responsible and very ready to help to mitigate the viral spread by providing us with information about potential persons they could have exposed. And, we really do say, look, it's not your fault, because there can be a lot of guilt associated with this. Someone who potentially went to work sick and is thinking, wow, I've exposed this number of people. It's not their fault.
Yeah.
And so, yeah.
Well, this transitions quite nicely into one of our final topics, which is going to be how different cultures are handling this pandemic. So you will obviously be able to speak to America, the culture of America, and how we're handling it. And I'm going to share with you a little bit about China and what I've heard from. I haven't been there while this is happening, but I'm pretty familiar with the Chinese culture. I've lived there for 5 years, and I've had friends who have been through it. And to my understanding, it's just been more of a situation where people are, for lack of a better word, maybe obedient or just willing to really listen to the guidelines of what the government is advising. And also the benefit of China is that, there's kind of one voice. They have state media, and there's kind of one voice kind of and one clear message as to what to do. Like, we're going to lock down the cities, and everything happens very quickly. And from what I've heard from friends that actually lived through it, it was very quick. People are, when you're riding the metro, you're instantly getting your temperature taken. Like they have the ability to move fast and act quickly. So I was wondering, after hearing that, kind of maybe comparing it a little bit to your experience here with just American culture and how people in general are kind of taking when they first hear about this, your experience talking to people, that kind of stuff.
Well, I think that, I mentioned people who have been exposed to someone with positive COVID-19, those people we contacted, and they were all like really ready to help. We did meet some resistance with travelers. There were travelers who came into the country who didn't contact us when they were told to. There were travelers that once we contacted them did not really buy into the fact that they were at risk and did not take quarantine seriously. So, we did have to bring in the sheriff's department to help us to do the drive-bys to ensure that people understood that a quarantine is a really serious thing. So, and I don't think that, we in the U.S., obviously, we don't have the capacity that China does to shut things down really quickly. And I also don't know that we really targeted the people we really needed to target with isolation and quarantine. We isolated and quarantined anybody we knew of that traveled outside of the U.S. And not one of our cases was someone who traveled outside of the U.S. They were all domestic and acquired cases, whether it be, it was from an international airport is another thing. But so I understand why travelers might have been a bit offended by putting in quarantine. But I've had travelers like block my number and refuse to answer emails and that type of thing. And so, I guess it's an invasion of people's privacy, and Americans are not, for the most part, willing to put up with that, unfortunately.
Yeah, I think you definitely, confirmed my suspicions, I guess, with that, in general. Americans kind of they do value their privacy, and I for good reason. I'm not really in this conversation to pick one side or the other. I just think, particularly for this situation, China's system of they respect authority and they're not going to block numbers; they're going to listen to advice, like regular Chinese citizens. So I just think it's interesting to compare the two cultures as to how individuals within this country are handling the situation versus how individuals in China were handling the situation. For one final note, you mentioned in your notes, as we're coming out of this, you hope for an advancement of healthcare fees or for services and insurance for all. I wanted to mention, I'm uninsured right now, and I'm looking into Medicare because I don't have a job currently. Like I'm based in Shanghai, but I'm here, and I'm looking at Medicare. What is your what is your feelings of the current state of healthcare for people who it's quite expensive in America? It's like the most expensive in the world. So could you talk a little bit about more your hopes for how it could be better, or that's a huge question, but yeah.
It is a huge question. And before the COVID-19 hit us, we were actually looking at a very innovative health, shall I say? I mentioned fee for service. So we were looking at a very innovative healthcare plan for our University of Vermont Healthcare Network, which would basically involve the hospitals and the healthcare providers. I'm not going to get into the nuts and bolts of it, but teaming together for a pilot of a fee-for-service program in which hospitals and providers are rewarded for success in treatment of patients. And it's all kind of driven by the lack of or the decrease in rehospitalizations. So in other words, if you did a good job treating the patient and the patient improved or became their healthcare became under control, whatever their health ailment was, then you would be rewarded for that in a fee for service. And but if there were complications or the person ended up back in the emergency room, then you might be penalized for that. So it's more of a reward system for doing a good job. And that's a very simple way to put it. So, but there is an innovative healthcare pilot system that we really hope to roll out in the North Country. And of course, it's been delayed right now. And part of that is decreasing the cost of care. So I think there's a lot of waste in the healthcare system today.
Wow.
And tests that are being done that don't need to be done. There's such a huge liability. If you don't do it, what if this happens? I better do that test. And I think that it's really, really complicated. And but there is definitely more efficiencies that can happen in healthcare. And everybody should be able to afford health insurance. I'm not so sure I believe in the Medicare for All system. But certainly, the Affordable Care Act made some really great advances, and I don't like to hear that people don't have health insurance. And I know, Alex, that you're in a situation being away from your home in China for an extended period of time, and also a young person and a healthy person. But you take risks. So I really hope that young people value health insurance and have access to it.
Well, I have so many questions I could ask about that, and I think I'll save it for another time. Final question. What do you think the future will hold for the coronavirus situation in the next coming months? Hopefully, definitely not. Hope it doesn't last a year, but, kind of your thoughts for the upcoming future.
It could. And then, if it doesn't, what's the next virus to hit? Viruses are very complex. And so I think that a number of people currently have immunity. I'm thinking that a vaccine may be up to a year out. And by then, will people value it, or will we still have anti-vaxxers that go, oh, no, I don't, the vaccine could could cause side effects such as autism. So I'm not going to do that. So I think that we have not hit the peak in New York State or in the United States, and people are going to continue to get really sick. If this hits a nursing home up in Essex County, we face a true crisis because the elderly people are so vulnerable, and we don't have enough ventilators to serve all the people that potentially could need them. The other thing up here we're facing is that, people are moving back to their second homes, and rightly so. They own property here, but if they become sick, we don't have the capacity in our healthcare system up here. So I think it's going to be really challenging in the next months to come. And, we can look at China at the things that they did right. And the fact that they had no new cases for, you probably know better than I, how many days?
I think it's been a week, maybe 5 days. 5 days. They have no new domestic cases, which is,
right.
the important thing to mention. But it's that what you say about people coming up for their second homes is interesting. I know several people who have gone up to Vermont, like people who live in New York City, or they just go upstate and just getting out of the city. Right.
Yeah. And so, some of our cases have stemmed from that migration for sure. So, it's people's rights that we're talking about. But also we need to think about what resources do we have here in our healthcare system if, people who migrate up here become sick. So, yeah. So the future, it'll be interesting to see what the future holds. Things have certainly changed, and I hope that we look back on this and we make some really positive changes in our healthcare system and our capacities. For
Susan,
sure.
Thank you so much for your time. This has been a very valuable chat for me. Thank you so much. And let's give a quick shout out to Otis Mountain. Hopefully we'll all be there in September.
There you go. I sure hope we are. But if not, then we're there in heart and spirit.
Exactly. Otis Mountain Get Down 2020. Let's go.
Thanks,
all right.
Alex.
Take care, Susan.
You too.
Bye-bye.
Bye.
Boom. That's it. Thank you so much for listening. If you found this podcast valuable, there are many ways you can support it. You can rate and review it on iTunes, Stitcher, or wherever you listen. You can share it with your friends, you can blog about it, or discuss it on your own podcast. If you are watching on YouTube, you can subscribe to my channel and like this video, or you can support it directly. You can do this by going to the shop on my website. I'll leave a link in the description. Thank you for supporting the show. Listeners like you make it possible. Again, if you are looking for information on how to protect yourself and stay safe from COVID-19, please get information from the CDC or the World Health Organization. Also, if you enjoyed the intro and outro music, it was made by my brother, Danny Greenberg. You can go and check out his beats on Apple Music, Spotify, YouTube, or SoundCloud. He goes by the name Estoric, Estoric. All right, that's it for now.